Imagine waking up with a sore throat so sharp it feels like swallowing glass. That's the phrase doctors in South Carolina are using right now as they warn about a surge in COVID-19 cases. They've nicknamed the latest variant razor blade COVID because of its most painful symptom, an extreme sore throat that patients describe as unbearable. But here's the thing, it's not just a local story. Across the United States, cases are rising again, and new variants are adding layers of confusion. Today, we're breaking down what you need to know, the symptoms, the data, and the latest vaccine guidance. Doctors in Charleston, South Carolina, say their clinics have already seen as many positive COVID tests this month as in the last 3 months combined. Dr. John Carter from Roper Express Care explained that many patients think they might have strep throat, but test results show COVID instead. The sore throat is paired with other flu-like symptoms, and the sudden spike is leaving some communities worried. While the term razor blade COVID might sound dramatic, it's helping people understand just how intense the pain can feel with this strain. This new strain belongs to the Omicron family, the same family responsible for most of the variants we've seen in the past 2 years. But while it shares similarities with previous versions, the standout feature here is the sore throat. Doctors stress that anyone experiencing a sudden, severe sore throat combined with fatigue, fever, or congestion should consider testing for COVID. Home test kits are still effective at detecting infection, and if a test is negative but symptoms persist, a medical evaluation is recommended to rule out other illnesses like strep or mono. With schools reopening in August, it's not surprising to see more sickness spreading in classrooms and among families. Doctors remind parents and teachers that the same old rules still apply. Stay home if you're sick, wear a mask if you're recovering, and cover your coughs and sneezes. These are simple precautions, but they continue to make a big difference. The Centers for Disease Control and Prevention still recommends staying up to date with boosters, which remain effective in preventing severe illness. Nationally, COVID trends show a slow but steady rise in cases. During the week ending August 9th, nearly 9% of all reported tests came back positive. That's up from the week before. About 1% of those cases led to emergency room visits, and less than 0.5% resulted in death. These numbers may sound small, but in a country of over 300 million people, even a slight percentage increase translates into thousands of sick patients and significant pressure on hospitals. Certain parts of the U.S. are seeing higher positivity rates than others. Western and southern states like California, Texas, Arizona, Nevada, Arkansas, and Louisiana are reporting above-average numbers. Even Alaska is on the list. This uneven spread is partly because reporting has slowed nationwide, making it harder to get a clear picture of exactly where the virus is hitting hardest. Still, the data shows clusters forming in regions where testing remains consistent. When it comes to variants, the CDC has been tracking a few key players. For the 2 weeks ending in June, the variant NB181 accounted for about 43% of cases, making it the most common. That's a huge leap considering it was almost non-existent back in April. Another variant, LP81, made up 31% of cases, while XFG, a newer arrival, sat at around 14%. Experts say XFG is gaining traction and could become more widespread in the coming months. The rise of these variants highlights how quickly the virus can evolve. In just a few weeks, one strain can move from being rare to dominant. That's why tracking continues to matter, even as overall case numbers are lower than in the early days of the pandemic. Experts emphasize that while symptoms can feel different, like the sore throat tied to razor blade COVID, there's still no evidence that one strain is uniquely dangerous compared to another. The biggest differences are in how easily they spread. The question many Americans are asking now is about vaccines. Who needs them and how often? Guidance has shifted this year, and it's causing some confusion. The CDC still highlights that vaccines are most important for people over 65, those who are immunocompromised, or those living in long-term care facilities. Pregnant people, breastfeeding mothers, and anyone at higher risk for long COVID are also encouraged to get vaccinated. Boosters remain a key tool in reducing severe illness, hospitalizations, and deaths. However, recent announcements from federal health officials have sparked debate. Earlier this year, the Department of Health and Human Services announced a narrower focus for vaccine recommendations, leaving some younger healthy groups unsure about access. In response, organizations like the American Medical Association and the American Academy of Pediatrics published their own guidance, continuing to recommend vaccination for a broader group of people. The World Health Organization has also reinforced the idea that vaccines remain effective against newer variants. What does this mean for everyday Americans? Essentially, if you're in a high-risk group or live with someone who is, it's smart to stay updated with vaccines. If you're younger and healthy, you may still choose to get vaccinated to avoid disruptions from illness, but access could depend on your local health department or provider. The bottom line: check with your doctor or trusted medical organizations for the most up-to-date advice. Now let's circle back to symptoms. The CDC reminds everyone that the most common COVID symptoms remain the same: fever, cough, shortness of breath, fatigue, sore throat, congestion, loss of taste or smell, headaches, and body aches. For some, nausea or vomiting can also occur. Severe cases can involve trouble breathing, chest pain, confusion, or lips and skin turning pale or blue. These are warning signs that require immediate medical attention. Doctors also point out that while razor blade COVID sounds scary, the core message is the same as it has been since the start of the pandemic. Know your symptoms, test when you're unsure, and isolate if you're sick. The painful sore throat may be new, but the approach to handling it hasn't changed. Early testing and care are the best ways to protect yourself and those around you. So, what's the takeaway as we move deeper into 2025? COVID isn't going away. It's becoming part of our daily reality, much like the flu. That means we'll continue to see seasonal spikes, new variants, and evolving guidance. But unlike the early days, we now have the tools and knowledge to manage it. Vaccines, testing, and simple preventive measures are still our best defense. And while headlines about razor blade COVID grab attention, doctors stress that awareness, not panic, is what helps communities stay safe. As cases climb in states across the country, one thing remains clear: COVID will keep adapting, and so must we. Staying informed, taking symptoms seriously, and following trusted medical guidance are key. Whether it's a sore throat that feels like razor blades or a more familiar cough and fever, what matters is recognizing the signs early, because at the end of the day, the goal isn't just to avoid getting sick. It's to protect each other, keep hospitals from overcrowding, and move forward in a world where COVID is just one of many illnesses we know how to handle.